Hello, welcome to the Rezoomex Podcast. Today we are here with Vinayak Joglekar, who will be talking about trust, speed, and why disputes in healthcare slow everything down, including patient care. We will use a slide deck to guide the conversation. Before we dive in, what's the core idea you want listeners to take away?
Thank you, Aria, for the introduction. The core idea is simple. Trust is operational. When trust is low, everything slows down. Decisions, care, payments. When trust is high, speed increases, cost drops, and patients benefit. The deck helps show why that happens and how automation can change it.
You talk about trust, speed, and better patient care. Why connect these three?
Because they're causally linked. Trust isn't a soft concept, it directly affects execution speed. In healthcare, slow execution shows up as delayed care. If we want better patient outcomes, we have to design systems that produce trust through results, not just oversight.
You mention large settlements and legal overhead here. Why start with that context?
Recently, ACNA agreed to an out of court settlement for $2.6 billion. They incurred $800 million in legal and administrative expenses. This shows the scale of the problem. Even after massive settlements, disputes don't disappear, they just move into monitoring and administration. When hundreds of millions go to legal and admin costs, that's a signal the system is resolving conflict inefficiently, not preventing it. This example is symptomatic of lack of trust between payers and providers in healthcare.
You quote Stephen M.R. Covey, results build trust. Why is that so central?
Because monitoring doesn't build trust, outcomes do. Covey's point is that when people see consistent results, trust rises naturally. In healthcare, we've tried to enforce trust through controls. That slows everything down. We need systems that demonstrate trustworthiness through execution. Think how easy it is to work with a trustworthy colleague.
This case study is of a payer network here. What does it represent?
A CN represents a large federated healthcare payer ecosystem. They cover more than 100 million Americans. They license their brand to 30 plus plans. These systems are powerful but fragmented. Policies are set centrally, but executed locally. That gap between intent and execution is where disputes are born.
And on the provider side, who are we talking about?
Large delivery systems, academic medical centers, children's hospitals, specialty networks. These organizations run on thin margins and depend on predictable reimbursement. When predictability breaks, disputes stop being administrative, they become existential. Finally, everything impacts patients.
You're careful not to blame one side. Why is that important?
Because distrust is structural, not moral. Payers see inconsistent billing and aggressive appeals. Patients with minor symptoms are prescribed expensive diagnostic procedures. Providers see opaque rules and retroactive changes. Coverage depends on the plan, and there is inconsistency in the way fine print is interpreted and rules are applied. Retroactive adjustments erode confidence. Both sides respond rationally but defensively. That mutual defensiveness is what we need to break.
I read that this large settlement is monitored by a committee. Isn't that supposed to solve the problem?
It's supposed to, but it often replaces trust with fear fear of being flagged, audited, or escalated. The committee is composed of two members each, from ACN and the providers. The fifth member is a judge who is neutral. It solves past behavior, not future disputes. Monitoring watches behavior, but it doesn't guarantee resolution. In fact, the committee can't enforce terms of settlement if a party refuses to comply.
What exactly gets monitored?
That's the question. It's supposed to monitor compliance with competition reforms, good faith behavior, consistency across ACN plans, complaint and escalation patterns. All important, but notice what's missing: speed, outcomes, and patient impact.
Oh, that's disappointing. So what's the gap?
No one is measuring what percentage of claims get reimbursed, how long disputes take to resolve, how long patients wait for prior authorization, or how much clinical time is lost. What is the impact on patient satisfaction? The system monitors intent, not results, and that's where trust breaks down.
You call this operational drag. What does that mean in practice?
continuous disputes, legal compliance overhead, everything diverting precious resources. It means lawyers, finance teams, clinicians, and executives spending time managing uncertainty instead of delivering care. It's invisible friction, but incredibly costly. Finally, who pays for all this? The patients.
That is really sad. How does all this impact the patient?
Through CYA behavior. When reimbursement and audits are uncertain, providers delay admissions, over-document, make conservative treatment decisions, and wait for prior authorization. It's rational self-protection, but patients experience it as delay and anxiety.
This must be really frustrating and agonizing for patients.
Absolutely, no one is measuring metrics that quantify the patient's experience. Number of days or weeks for prior authorization, number of days to start treatment, percentage of time spent by clinicians on admin work. We must start measuring so that we know what needs fixing. These aren't abstract problems. They show up as postponed or abandoned care.
You referenced the settlement FAQs page hosted by ACNA. I checked it out. The answers show apathy and time insensitivity.
You are spot on. The processes recommended are legally sound but operationally heavy. Eligibility checks, manual claim submission, repeated attestations, reviews, appeals, delayed payments, post hoc audits. Each step adds delay and erodes credibility.
These are huge problems. Do you think smart contracts can change this?
They are way better. They don't remove safeguards, they encode them. Rules are enforced automatically. Data is validated upfront. Outcomes are deterministic. Calculations would be transparent and easy, and payments can be triggered automatically. You get the same protections with far less friction.
Where does Rezoomex fit?
Rezoomex build playbooks that capture personas of the parties, their working agreement in form of jobs to be done. The playbook applies smart contracts to dispute resolution. Rules written in English can be automatically encoded instead of arguing after the fact. Parties agree on rules up front and let execution do the work. Trust is no longer promised, it's proven. Moreover, as the smart contracts are immutable, they are auditable and tamper proof.
Some might worry this bypasses oversight. Does it?
No, it strengthens it. Automation removes human bias. Rezoomex reduces the number of disputes that ever reach monitors. Compliance becomes visible by default, not something you prove with paperwork later. Increased trust in the system moves things faster.
It's time we start wrapping up. This comparison slide is powerful. Sum it up.
Monitoring relies on discretion and escalation. Automation relies on execution and resolution. One creates fear and uncertainty, the other creates predictability, and predictability is what builds trust
Bring it back to patients. Why does trust matter so much?
because trust speeds decisions. Providers act with confidence. Admissions happen faster. Coverage is clearer. When trust improves upstream, care improves downstream.
What's the net effect?
Lower legal cost, less drag, better relationships, and better patient experience. Speed goes up, cost goes down, quality improves, exactly as Covey predicted.
Final thought for listeners?
Trust isn't cultural, it's operational. If we want faster care and better outcomes, we have to design systems that produce trust through results. That's what automated dispute settlement makes possible.
If listeners want to explore this further,
Start by asking, where does uncertainty slow us down today? Then design for results, because results are what build trust.
thank you, Vinayak, for this insightful presentation. If you like this episode, please subscribe to our podcast on YouTube. This is the Rezoomex Podcast, and I am your host, Aria, signing off.